Today, we're talking about a really important warning sign that comes from one of your body's absolute powerhouses, the liver. The condition is called hepatomegaly, and, understanding what it means could be the key to protecting this incredible organ from some serious long-term damage.
So let's say you're at a checkup, and the doctor mentions your liver feels a little enlarged. What does that even mean? Is it a disease? Is it something to panic about? It's definitely an unsettling thing to hear, but here's the first thing you need to know. It's not a diagnosis. Think of it more like a signpost. It's your body raising a little red flag that something else is going on under the hood.
And that's really our first big idea here. An enlarged liver, or hepatomegaly, isn't a disease all on its own. It's much better to think of it as a symptom, a physical clue that points to an underlying problem that, we need to figure out. So the bottom line is this. Hepatomegaly is just the official medical term for this enlargement. It's the starting line for an investigation, not the finish line. The liver is getting bigger for a reason, and the real detective work is figuring out why. Essentially, the liver is reacting to one of three main things. It's either being injured by something like a virus or a toxin, or it's being overloaded with stuff it has to process, think fat or alcohol. Or the third thing is it's being infiltrated by abnormal cells or substances that just don't belong there.
So how does this actually happen? I mean, on a cellular level, what's going on? Well, it turns out there are 5 main ways, 5 key mechanisms that cause the liver to physically get bigger.
Okay, so the how really breaks down into these 5 paths. First, you've got simple inflammation, which can make the liver cells themselves, the hepatocytes, just swell up. Second, there's fat accumulation, which has a fancy name, steatosis. Third, you can get congestion, where blood literally backs up inside the liver. Fourth is infiltration, by things that shouldn't be there, like cancer cells. And finally, there's hyperplasia, which is when the liver tries to regenerate new cells to heal itself from damage. A couple of simple analogies really help this make sense. Congestion is basically a massive traffic jam on a highway. Blood can't get out, so it backs up and just swells the liver. And infiltration and fat accumulation, that's kind of like a warehouse that's being filled up with all the wrong cargo, eventually stretching its walls to the limit.
All right, so we've covered the how. Now let's get to the question you're probably asking: why does this happen? The list of potential causes is, it's pretty long, but a few key culprits really stand out from the crowd. And here's the big one. In many, many countries, the #1 cause, by far, is fatty liver disease. Now, this can be from alcohol, sure, but more and more, it's from metabolic issues tied to our modern diets and lifestyles. That's called non-alcoholic fatty liver disease, or NAFLD. And this is a direct result of that fat accumulation mechanism we just mentioned. And as you can see, the full list of potential causes is really extensive. We're not going to go through every single one, but what's important is how they're grouped together. The cause could be an infection, like hepatitis. It could be a metabolic issue, like that fat overload. It could be a tumor or even the body's own immune system attacking the liver. It could even be a reaction to a prescription drug. This huge variety is exactly why a careful diagnosis is so critical. To make this a little more concrete, let's look at a real-world example. Here are the top 3 causes found in the United Kingdom. #1, alcoholic liver disease. No surprise there. #2 is cancer, especially cancers that have spread to the liver from somewhere else. And #3, congestive heart failure, which causes that blood traffic jam we talked about earlier. Okay, so with all these potential causes, how on earth do doctors figure out what's actually going on? Well, they follow a really logical diagnostic path to narrow down all the possibilities.
And what's amazing is that this whole investigation often kicks off with something super simple, totally low-tech. It's just a doctor, during a routine physical exam, feeling that the liver is a bit enlarged. From that simple discovery, a whole high-tech investigation can begin.
From that point, the process works kind of like a funnel. After the physical exam, they'll do blood tests to check how well the liver is functioning. The next step is usually an ultrasound. It's a fantastic first-line imaging tool. If they need an even closer look, then come the CT or MRI scans. And for the most complex cases, when they need the absolute definitive answer, they might take a tiny piece of the liver for a biopsy. So once the cause is found, the goal of treatment becomes crystal clear. It's really a 2-part approach. First, you've got to treat the specific underlying problem, whether that's getting diabetes under control, stopping alcohol, or treating an infection. And second, you have to do everything you can to stop the damage from getting worse and progressing to cirrhosis, which is a state of severe, irreversible scarring. And this right here brings us to the most critical takeaway of this whole explainer.
The outcome, the future of your liver, truly depends on how early the problem is caught. Your liver is amazingly resilient, but it does have its limits.
This slide really shows a powerful contrast. It's like a tale of two timelines. In the early stages, say simple fatty liver, the condition is often completely reversible. Lifestyle changes, like improving your diet, getting some exercise, cutting out alcohol, these can allow the liver to actually heal itself. But if that injury just keeps happening over the long term, it starts to cause fibrosis, which is scarring. And eventually that scarring can become so severe that it leads to cirrhosis. And that's the point of no return. It's permanent damage.
This analogy to the heart is just perfect. Think about it. Just like an overworked heart, the liver will compensate for a long, long time, quietly dealing with ongoing damage without you even knowing it. But there is a tipping point. Once that chronic injury leads to widespread fibrosis and scarring, that amazing resilience is lost and the damage becomes permanent. So we end with this question: an enlarged liver is a signal. And whether that signal is just a temporary warning that you can fix or a permanent alarm bell for irreversible damage, it all depends on finding the cause and, most importantly, acting on it.